Urinary incontinence, functional impairment. Urinary incontinence due to functional impairment is also known as functional incontinence. It used to be called social incontinence. This type of incontinence is due to any factor outside the urinary tract that prohibits the individual being aware of bladder filling and responding appropriately to that signal. It is considered a type of bladder storage problem. Some of the most common comorbid conditions associated with functional incontinence include frailty, cognitive impairment, and mobility issues. Frailty is a syndrome that includes reduced strength and endurance and physiologic function that increases the older person's risk for dependency and death. Frailty is commonly seen in those over 80 years of age or in those with multiple comorbidities. Individuals may have a variety of disabilities along with frailty. It can also be associated with an increased risk for incontinence. In devising a management plan, one must discuss the plan, if the person is mentally able, for the individual's preferences and goals. Also consider the reversible, acute cases of incontinence and treat them. The toileted mnemonic is helpful. Remember, the T is for thin, dry epithelium, such as atrophic vaginitis and urethritis. The O is for obstruction from constipation or impacted stool. I is for infection. L for limited mobility. E for emotional issues such as depression. T for therapeutic medications or polypharmacy common to most elderly people. And E for endocrine disorders such as diabetes mellitus or diabetes insipidus, and the D stands for delirium. You may wish to review the acute causes of urinary incontinence in the introductory lesson. Those with significant mobility issues rely on others to assist them with toileting, or it takes them longer to get to the toilet facilities. If the individual is unable to get to the toilet in a timely manner, or others are unable to provide assistance at the needed time, the person will be incontinent. Mobility barriers may include those in the environment such as door width issues, stairways, and difficult toilet access, as well as the individual's personal mobility difficulties. Those with cognitive deficits are unable to understand or recognize the sensation of bladder filling, or do not remember the appropriate steps for toileting. Therefore, the bladder will respond to bladder filling rather than the conscious process involved with voiding. Generally, urinary incontinence due to functional impairment is not an isolated disorder and can include urge and stress incontinence. The mobility and cognition disorders associated with functional incontinence can make using and getting to the toilet difficult and can make or break the success of managing the associated urinary incontinence treatment modalities. There is no specific test for urinary incontinence due to functional impairment. One can ask the patient to demonstrate their ability to move and get to the toilet. This can easily be seen by observing the person walking down the hallway and entering the exam room. An assessment of an individual's mental status through the use of the mini mental status exam should be included on the examination. You can also have the patient draw a clock face with a specific time delineated. It is important to remember that when an individual is incontinent due to functional problems, other problems can also occur, such as a fall that causes a hip fracture. In managing functional incontinence, one is helping to prevent other health-related problems. When admitted to acute care, the thought of many is to use a containment garment in order to deal with the continence issue. Studies demonstrate that the use of containment products increases the risk that the individual will be incontinent at the time of discharge. So one must be thoughtful when using containment garments and perhaps choosing another method of managing the incontinence in the acute care setting. Treatment is dependent on the exact type of the functional problem. For those with mobility issues, use of a bedside commode, a raised toilet seat, and consultation with physical therapy and occupational therapy are appropriate interventions. PT and OT will have suggestions as to the methods to assist with mobility, including handrails, adaptive devices, widening the door to the toilet, or use of a ramp for those with a wheelchair. Clothing changes may include use of Velcro closures, stretch waistbands rather than zippers or buttons, and skirts rather than trousers. Handheld urinals are available for both men and women and may be of benefit for those with mobility issues. In other words, for those with mobility issues, it's important to maximize mobility, accessibility, and dexterity for the individual. For those with cognitive impairment, toileting programs such as prompted voiding, habit training, and timed voiding can be successfully used. It's important to remember that the success of this program rests with the dedicated caregivers involved being fully committed to the program. Prompted voiding is useful for the person who's able to recognize a full bladder and respond when prompted to void, but may have the functional limitations prohibiting them from getting to the bathroom. The individual needs to be able to tell if they are wet or dry and make a judgment on the need to void. It is a useful technique for individuals with compromised mobility or mild to moderate degrees of cognitive impairment. The person is prompted to use the toilet and asked if they have to void, then given a social reward if successfully toileted. Habit retraining requires identification of the individual's own voiding pattern. A bladder diary is obtained for baseline information. A schedule is then devised based on the bladder diary with the goal of toileting the individual prior to the incontinent time. Timed or scheduled voiding provides toileting assistance on a consistent schedule. There are no attempts to individualize the program or provide motivation. The individual is assisted to the bathroom on a fixed established schedule, such as every 3 hours. The technique is most appropriate for the cognitively intact person with mobility issues. Remember, too, that sleep is important for good health, so during the nighttime hours, the caregiver can choose to use some form of a containment garment and skincare. It's also important to remember that whenever a toileting program is used, containment garments and scrupulous skincare are an important adjunct. This ends the lesson on functional incontinence. Thank you for your attention.